Today, actually, I want to talk about breast cancer. And I think breast cancer is unisex. I mean, it can affect both women and men. It doesn't choose. So don't rule yourself out saying, I am a man and therefore it's not for me. It's good for you to know some of the factors and some of the signs and symptoms that might really show that you have breast cancer, and it helps you to get a treatment as early as possible, or rather this information can help you to save someone somewhere. And the most important point here to note is breast cancer, most of the time it is usually identified by the patients themselves. Actually, it's rare for just someone to walk to hospital and it's the doctor who is identifying that, oh, you have breast cancer. Actually, it is usually either the patient themselves or their partners that help them to identify that they are having something that is abnormal on their breast. And therefore it is important for us to be doing our self breast examination at least monthly. And for women, it is always good for us to do our breast examination after menstruation, because this is the time you can pick out most of the things. Okay, some of the signs and symptoms might be confusing because women usually have what we call menstruation, breastfeeding, and other things, and all these have like similar signs and symptoms of what I'm going to mention. So I want to put some of the factors constant so that we can try to rule out what are some of the abnormal signs and symptoms. Some of the factors that might be normal when you feel like this, or when you have this condition: if you are breastfeeding, if you are menstruating, when you have a cyst or a breast engorgement, mastitis, and maybe you are pregnant. These are some of the factors that can affect your breast. You can start feeling some of the symptoms that I might mention here. So let us put these factors constant. You are not pregnant, you are not having a cyst, you are not having all the factors that I've mentioned. Therefore, if you are not having those factors and you are having these signs, it's good for you to go check for breast cancer. One of the factor is inverted nipple. If you have an inverted nipple, it is a sign that maybe you are having a lump that is pulling on the nipple, therefore inverting it inside. It's good for you to do your self breast examination and also to go see the doctor as soon as possible. Also, nipple discharge. When you press on the nipple, it's discharging either pus or blood. It is a danger sign. If you're not breastfeeding, you are not having the factors that I have mentioned, and you're having nipple discharge, it is a danger sign or an early sign of breast cancer. Also, if you feel like you have a lump, a hard lump or a bump in your breast, when you are doing your own breast examination, you feel there is something hard, that is an urgent need of you seeing the doctor. Also, sometimes you might feel hot, red, and painful breast until it's not easy for you to put on a breast or even putting on a cloth, because it is very, very painful. Any painful breast that is not caused by things that I mentioned, the factors that remains constant. Therefore, it's good for you to take it seriously. Also, if you have an itching breast, very itching and irritating, and maybe you have not changed your ointment, or your skin is not dry, everything is okay, you are doing your things routinely since you are young, and now this is something that has just changed and you feel like it is itching constantly and it is irritating, it's a sign that you need also to be checked. Also, breast thickening. You feel like your breast is thick at a certain point. It's not a lump, but it's thick. Breast thickening. It can be warning you and also trying to show you like there is a problem that is coming in. Also, if you are on the maybe you are doing a self examination on the mirror and you see there are enlarged veins coming from the armpit to the breast, and they're getting enlarged in size, that one is a clear green light that it's not a good sign. And also you might have lymph nodes. Lymph nodes are always warning sign. They are like our watchmen. They tell us that, oh, there is someone who is attacking you. So lymph nodes and enlarged veins on the breast, that one can be something that you really need to be checked on. There are also other factors like you just feel like your breast has changed in size and shape. Your shape of the breast has changed suddenly, and maybe one breast is floppy. When you raise up your hand, you feel like one breast is floppy. It doesn't come up with the other. It doesn't come up with the hand. It's not a good sign. It's weak. It's weak. Also, this can be done the same to the men. For men, you have no factors to remain constant. For you, when you see all these signs, it is something to be investigated, because you are not breastfeeding, you are not pregnant, you are not menstruating, you are not having mastitis, you are not having all those factors. For you, they are not constant, they are not there. So if you see any changes in your breast as a man, don't say I'm a man, because there are so many men who have died of breast cancer because they ignore, meaning that thinking that breast cancer is only for women. Actually, early diagnosis of any cancer leads to good prognosis, and also management becomes easy, and you get cured. Yeah, you get cured easily. Don't wait until it goes to another stage. Also, let us see what are some of the things that will make you be on alert. Like, I need to be checking myself more frequently, and just make you to be alert. Like, if you are having cancer of somewhere else, like you have cancer of the ovary, you have prostate cancer, any other type of cancer, there's what we call metastasis. Cancer moves from one place to another. You have cervical cancer, you have any type of cancer, always be checking tumor markers of other type of cancers, including breast cancer. It will help you detect other cancers as early as possible. I'm not saying that when you have one cancer you'll have other cancers, but it's good to check. For the other checkup, you'll see even your doctor will be telling you need to do mammogram, you need to do pap smear, you need to do your self-scrotum examination. It's very, very important, and other tumor markers that are done through blood and whatever. Also, if you have a family member who has suffered breast cancer, it's also an indication. It also depends with where you come from. Some breasts are predisposed or have high chances of getting breast cancer than others. Just be vigilant. Don't say that I have never seen, I've never had. You might be the first one to help others or educate others by this information, or even save your own. You can also save yourself through this information. Cancer can be managed through, depending with the staging, breast cancer can be managed through surgery, mastectomy. They can remove that breast depending with the stage that it is, and then they can also receive radiation and chemotherapy. And if you have not watched my other videos, I've talked about the side effect of radiation and side effect of chemotherapy before starting any. So you can go watch and learn more of how to take care of yourself, just in case you have someone who is suffering from this or who is receiving chemotherapy, radiotherapy, because this is part of management of any cancer, regardless of where the cancer is. So it's good to know some of the side effects and how it can be managed. And apart from radiation, how will you manage self-esteem as a woman? If they remove one breast, how are you going to take care of yourself? It's very important how you bring up your self-esteem after treatment or during treatment.